The ability to establish a therapeutic relationship with patients is one of the most important skills a nurse can develop. It's especially important in mental health nursing, as building the therapeutic relationship and having therapeutic communication is the basis for successful treatment. Many factors influence the therapeutic relationship, and it's the nurse's job to develop them. Trust. Trust builds when the patient is confident in the nurse and when the nurse conveys integrity and reliability. Trust builds when the patient believes the nurse will be consistent in word and action and can be relied on to do what they say. Don't make promises you can't keep, and if you tell the patient you'll do something, be sure it's done in the time you said it would be. Congruence, or when your words and action match, is essential to building a therapeutic relationship. Show genuine interest in the patient. They can tell when you're distracted or not really paying attention to what they're saying. Be open and honest with the patient, but be careful about sharing personal experiences, particularly if they are recent or ongoing. Empathy is the ability to understand what the patient means and feels, and to communicate that understanding to the patient, or to be able to put yourself in the patient's shoes. Empathy is being able to imagine how the patient feels. Both the nurse and patient give a gift of self when empathy occurs. The patient feels safe enough to share their feelings, and the nurse by listening and understanding. This is different than sympathy, or feeling what the patient feels. Sympathy will wear you out and cause you to burn out. Acceptance involves avoiding judging patients regardless of their behavior. It doesn't mean accepting inappropriate behavior, simply accepting the person is worthy. As the nurse, you have to set boundaries on appropriate behavior and be firm on those boundaries without becoming angry or judgmental. Positive regard is an unconditional, non-judgmental attitude. Calling the patients by name, spending time with them, avoiding negative opinions, and listening to them all convey respect and positive regard to the patient. Before you can begin to understand your patients, you need to know yourself. Self-awareness is the process of developing an understanding of your own values, beliefs, feelings, attitudes, and how these affect others. Values give a person a sense of right or wrong and establish a code of conduct for living. Values clarification is helpful in gaining insight to yourself and what's important to you. There are 3 steps in the values clarification process. Choosing occurs when you consider a range of possibilities and choose the one that feels right. Prizing happens when you consider the value, cherish it, and publicly attach it to yourself. Acting is when you put the value into action. Say you value cleanliness, but your roommate does not. So you begin to feel tense at home, and you might start to avoid going there when you don't need to be there. You realize that you and your roommate choose to use the personal space differently, choosing, and discuss the conflict with your friends, prizing. You go home and find a way to negotiate a compromise with your roommate, acting. Beliefs are ideas that you hold to be true. Some beliefs have objective evidence to support them while others don't. Attitudes are general feelings around which you organize knowledge about the world. A positive mental attitude occurs when a person chooses to put a positive spin on an occurrence. Some attitudes include hopeful, optimistic, pessimistic, positive, and negative. If you're stuck in a line at the store, the person with a positive attitude may cheerfully begin chatting with the person next to them, happy to make a new friend, while the person with a negative attitude may mumble under their breath about the store wasting their time. Hildegard Peplau developed the idea of therapeutic use of self. It involves the nurse using aspects of their personality to establish a relationship with the patient. Nurses can use themselves as a tool to help patients grow, change, and heal. Peplau believed that nurses had to understand themselves in order to help their patients grow and to not limit them to the choices the nurse values. One tool to help you learn about yourself is the Johari window, which creates a word portrait of a person in 4 areas and indicates how well the person knows themselves. Quadrant 1 is the open or public self. These are self-qualities you know about yourself that others also know. Quadrant 2 is the blind or unaware self, self-qualities that are known only to others. Quadrant 3 is the hidden or private self. These are self-qualities known only to yourself. And quadrant 4 is unknown. It's an empty quadrant to symbolize qualities as yet undiscovered by yourself or others. Peplau identified preconception, or ways one person expects another to behave or speak, as a roadblock to the formation of an authentic relationship. Preconceptions can prevent people from getting to know each other and may prevent a nurse from developing a therapeutic relationship with a patient. 4 patterns of knowing have been identified in nursing. Empirical knowledge is derived from nursing science. Personal knowing comes from life's experiences. Ethical knowing is derived from moral nursing knowledge. And aesthetic knowing comes from the art of nursing. In 1993, Munhall added a 5th pattern, unknowing. The state of unknowing allows the nurse to see and hear the patient's views without imposing any of their own values or viewpoints. The nurse admitting they don't know allows for a more authentic encounter. Every relationship is unique due to the various people involved, but there are 3 major types. Social relationships are initiated for friendship, socialization, companionship, or the accomplishment of a task. Communication may be superficial and focuses on sharing ideas, feelings, experiences, or giving advice. Roles may shift during a social interaction. Outcomes of this type of interaction are rarely assessed. When a nurse and patient engage in small talk, this is a social interaction. Intimate relationships involve 2 people who are emotionally committed to each other. Both people need to have their individual needs met, and they help each other to meet the needs. It may include sexual or emotional intimacy as well, and share mutual goals. Evaluation of the interaction may be ongoing, or it may not. Intimate relationships should never happen between a nurse and a patient. A therapeutic relationship is a very different relationship from a social or an intimate one. It focuses on the patient only. The nurse and patient agree on what areas to work on and evaluate the outcomes. The nurse uses communication skills, personal strengths, and understanding of human behavior to interact with the patient, but the benefit is all for the patient only. Peplau's model has 3 phases in a therapeutic relationship: orientation, working, and termination. In the real world, these phases will likely overlap with each other. Orientation. This phase begins when the nurse and patient meet, and it ends when the patient begins to identify problems to examine. In this phase, the nurse establishes roles, the purpose of meeting, identifies the patient's problems, and clarifies expectations. Before meeting the patient, the nurse reads background material on the patient, looks at their medications, gathers needed paperwork, and arranges a meeting place that is preferably quiet and comfortable. The nurse should consider potential barriers to preconceptions. The nurse begins to build trust during this phase. Confidentiality gives the patient the right to keep any of their information private that they want private. Adults can choose who they want to give information to, while the parents of minor children will do that for their child. Be aware of the patient asking you to keep a secret. Don't make those kinds of promises. It can jeopardize trust if the patient says something you're obligated to share with others, like a duty to warn, if the patient is threatening someone, or if the patient's threatening to harm themselves. Self-disclosure means revealing personal information about yourself. Self-disclosure can help improve rapport, convey support, and demonstrate normalcy. It may help the patient feel more comfortable and be more willing to share. It should be used judiciously, and the nurse needs to consider any cultural factors and the benefit to the patient. The working phase is divided into 2 subphases: problem identification and exploitation. In problem identification, the patient identifies the issues or concerns causing problems. During exploitation, the nurse guides the patient to look at their feelings and responses, to develop better coping skills, and to develop a more positive self-image. This encourages behavior change and increased independence. The trust the nurse has developed is important in this phase, as the patient has to believe the nurse won't reject them when they discuss their issues and problems. Patients may use testing behaviors to see what the nurse will do, so it's important for the nurse to stay focused and not be distracted. Tasks in the working phase are to maintain the relationship, gather data, explore perceptions of reality, develop positive coping skills, promote a positive self-concept, encourage verbalization of feelings, facilitate behavior change, work through resistance, evaluate progress, and promote independence. As the nurse and patient work together, the patient may transfer feelings they have for a significant other to the nurse. This is transference, and it can be either positive or negative. Countertransference occurs when the nurse transfers feelings to the patient. Self-awareness can help the nurse see when transference or countertransference might happen and be better able to respond therapeutically to those situations. Termination is the final stage in the nurse-patient relationship, and it begins when the problems are resolved and ends when the relationship is terminated. The patient may feel the end of the relationship as a loss and may deal with those feelings by getting angry or acting out. It's okay for the nurse to let the patient know they'll be remembered, but it's not okay to agree to meet them outside of the therapeutic relationship. There's always a danger of behaviors that will diminish a therapeutic relationship. Inappropriate boundaries occur when the relationship becomes social or intimate. The nurse needs to maintain professional boundaries to ensure the best therapeutic outcomes for the patient. Be friendly, but remember you are not friends with the patients. Be aware of your feelings and don't let empathy turn into sympathy. If you feel sorry for the patient, you may try to compensate by trying to please them. This makes it easy for the patient to manipulate you and discourages the patient from exploring their feelings and resolving their problems and leads to patient dependency. The relationship between a nurse and patient can be jeopardized if the nurse doesn't like the patient's behavior and lets it show. If the nurse feels that they aren't able to put their personal feelings aside, they may need another assignment. Some warning signs of abuse in the nurse-patient relationship: secrets or a reluctance to talk about the work that's being done with the patient, an increase in phone calls between the nurse and a patient outside of clinical hours, the nurse making more exceptions for one patient than for others, gift giving, extended one-on-one sessions that other patients don't get, spending time with the patient off the clock, and ignoring the agency policies. A nurse has various roles when providing care to a patient. Use the appropriate role for the work that's being done. Teacher. The teacher role occurs in most aspects of the nurse-patient relationship. The nurse may teach new coping skills, about new medications, about available community resources, and so forth. Be honest about what information you can give and refer them to others when needed. Caregiver. The primary caregiving role in mental health is to initiate the therapeutic relationship to build trust, to explore feelings, and assist in problem solving. Advocate. Advocacy is acting on the patient's behalf when they aren't able to do so. In the advocate role, the nurse informs the patient and then supports them in their decisions, although that can be tricky in mental health. You can't allow a patient to harm themselves or others, even if that's the decision they make. You have to ensure their privacy and dignity as much as possible, promote informed consent, ensure safety, and assess needed services and benefits. In mental health, there's times when acting in the patient's best interest is in conflict with their wishes, like if the patient wants to hurt themselves. They may have to be involuntarily committed against their wishes in that case. Parent surrogate. A nurse may be required to provide personal care, such as feeding or bathing, or a patient may behave in a childlike manner, tempting the nurse to assume a parental role. The nurse may become authoritative, which can cause the patient to become childlike. In these situations, the nurse has to set limits or keep the previously set limits. Being open and non-judgmental will allow the nurse to maintain a therapeutic relationship with the patient. Self-awareness is crucial to developing a therapeutic relationship. Being aware of prejudices or preconceptions will give the nurse a better chance of being authentic with the patient and developing a good relationship. Helpful activities for becoming self-aware include values clarification, journaling, group discussions, and reading. Developing self-awareness is an ongoing process. Compassion fatigue occurs when the nurse takes on the burden of the patient's experiences and may be unable to leave work at work. Learning to care for yourself as a nurse means finding a balance between work and home life, building satisfying personal relationships, and taking some time to relax and pamper yourself.